Metabolic response to injury. So the living tissue has the ability to keep the internal environment composition is stable. Okay. So if the patient get surgery or trauma, injury, there will be a reaction secondary to this injury. في شيء غير طبيعي صار في الجسم لازم يصير في reaction. طب releases tissue factor, inflammatory mediator, cytokines with blood loss from the injured tissue starts the cascade of this process هذه كلها ايش؟ including neurological, hormonal, كويس, and inflammatory marker with effect of the metabolism. The aim of the response is to stop and limit the damage. كل الرياكشن هذه تصير to stop and limit the damage, to maintain and redistribute the blood flow to the vital organs, and to fight infection and promote healing and recovery. The patient after injury or trauma or surgery اللي هي the same أصلا goes into two phases اللي هي first stage of EPP phase and second phase. EPP phase in which the injury is still going or shortly after just finished with no compensation from the body. Okay. The second phase, flow phase, when the injury has been stopped or controlled, the body tries to stabilize and restore the internal environment composition. First stage or phase, early after injury, there are low cardiac output, tissue hypoperfusion, and anaerobic metabolism. Okay, then the second phase, اللي هي flow phase, during the first second to fourth week after the injury, maintained cardiac output, restoration of the tissue perfusion, and catabolic, then anabolic metabolism started. Compensatory mechanism after injury. وش الميكانيزمز اللي ممكن تصير to compensate what happened? Neurogenic, sympathetic stimulation, hormonal, adrenal and hypophyseal hormone release, SERS اللي هي inflammatory mediators and cytokines, metabolic changes, blood constituents blood changes اللي هي ال contents اللي حنقولها بعد شوي. So what are the net results? Is blood flow redistribution, blood volume restoration, maintaining cardiac output, metabolic shift into catabolism, then anabolism, SERS, and thermogenic, then recovery. Neurogenic phase اللي هي sympathetic stimulation, pain, fear, hypotension, all of these lead to increase in the sympathetic nervous system stimulation. Okay, which will result in what? Increased heart rate, vasospasm, and vasoconstriction, I mean, which all of these will increase the blood pressure and the volume. Hormonal through what? طبعا increase sympathetic flow, hypovolemia, hypotension, hyponatremia, and hyperosmolarity will increase the release of many stress hormone, كويس, like cortisol, will result in increase in the response of the vascular muscle to catecholamine and breakdown of the protein fat. Okay, Renin angiotensin 2 aldosterone axis will be stimulated and will end up increase the peripheral vascular resistance and blood pressure. ADH and vasopressin will increase, and they will increase the water gain and the volume. SEERS, what will happen here? Inflammatory mediators and cytokines. So it's a state of generalized systemic inflammatory response. This is very important. A state of generalized systemic inflammatory response usually follow what? The injury. وش اللي يصير? What will happen? Release tissue factors, WBC, cytokines, activation of the plasma inflammatory mediators. So the patient experienced التالي بيكون عندنا low grade fever, increased WBC count, tachycardia, low CO2 level from what? From high respiratory rate or tachypnea. So هذه very important terminology. SEERS alone معناته low grade fever, WBC count will be a little bit higher than normal. Okay, the patient will be tachypnic and tachycardic. This is all normal reaction after any injury or trauma. But if the patient has sepsis, that doesn't mean SEERS. That means SEERS plus infection. Okay, if the patient has septic shock, that means the patient has sepsis, but this sepsis will end up with hemodynamic instability. واضح? So SEERS is a normal reaction after any injury or trauma. Okay, but what is not normal is that if you have infection. Infection doesn't mean SEERS. Infection means that there is something more than SEERS, right? So other slides actually is a repetition of the what I mentioned before. So there will be, after any injury, there will be a marked blood changes or change in the volume, and the blood plasma and fluid loss will be will get redistributed because of the vasoconstriction اللي هي ناتجة عن neurogenic stimulation and hormonal stimulation. Okay, and there will be also hyper volemia. So what will happen to the blood content during the post-operative or post-injury, after injury? So at the acute phase, there will be increase in the WBC and platelet count. And regarding the hemoglobin in the first hours or few hours, there will be no change in the hemoglobin, but there will be a drop later, especially if there is a bleeding. During the recovery phase, the WBC and platelet count will normalize. Hemoglobin level and RBC count will be normalized later within 2 to 4 weeks. طبعا هذا without blood transfusion. نتكلم على normal process. طبعا some of other materials like plasma protein will be released. There will be decrease in some of the elements like albumin and transferrin as well. طيب, هنا also very important, how to enhance recovery and fast-track surgery. This is very important. The concept behind it is to decrease the catabolic state and increase the anabolic state. How to do that, especially after surgery, or if you have a trauma patient? Prevention of pain with analgesia, early mobilization, very important. Early oral intake, this is very, very important. And nutritional support. If the patient in the ICU cannot eat, it's better to start the patient immediately on nutritional support with NG feeding or other sorts of feeding tube. Combined general and regional anesthesia is very important to control the pain. طبعا minimal access surgery, respiratory exercise is very important to prevent chest infection. Point to remember, metabolic response depend on the magnitude and duration of the injury. So if you have more tissue damage, the recovery rate will be longer. So tissue damage, pain, and volume loss, and the consequence after the injury, اللي هي starvation والpain والinfection. So prevention of the infection, the treatment of the pain, feeding the patient, all of these will increase and exhalate and stimulate and make the recovery period shorter. The aim is to stop the injury and control the damage and recover. I think that's the most important thing in this surgery. Any question? In this, I mean, محاضرة or lecture. Any question?